So to share a few thoughts on this, health and care is certainly a team endeavor. It's increasingly complex and interconnected, and therefore we can't be delivering this as single entities acting on their own. So given this, organizations need a strategy that recognizes those independent interdependencies. At Kaleidoscope, we think about how value can be created in partnership in four main ways. So through shared delivery, that might be creating a new service together or a new care pathway. Through shared learning, what works here could be useful somewhere else. Best practice, positive deviance, that sort of stuff. Shared voice, coming together to lobby collectively for a change in legislation or for some funds to do something, or aligning plans, just making sure that that services and pathways aren't bumping into each other, but are connected with effective handovers. Now, all of these are ways that add value. But where we've seen difficulty is when different people have different understanding of how that value is going to be created or which form we're going to be using. So, for example, if you're coming together to create value through shared voice and partnering and developing a strategy to lobby or to request more funding, then you might want to include your comms directors, for example. And similarly, if you're coming together to shared delivery, then you might want to make sure your directors of ops are there. So where we've run into problems is where different people have different visions for how that value is created. So being clear on that can be really, really helpful. We'll explore this a little bit further by looking through those two lenses that Rich introduced earlier. So pop to the next slide. The first is about developing strategy as an organization with a system. So we think about this in terms of these four elements that can be helpful. So number one, understanding your organization's role in the larger system and what are your strengths? How do they contribute to the overall system? What do you do better than anyone else? Where do you depend on others? And for instance, a mental health trust could recognize their role in reducing A&E admissions by providing community-based crisis services. And that's an example of how one organization's thinking in that system way. Number two, aligning organizational goals with system-wide objectives. Number three, identifying and prioritizing key stakeholders and partners. And this is much about deprioritizing as it is about prioritizing. Speaking with a senior leader earlier who was saying that if he attended everything that he was invited to, he wouldn't have any time at all to do his day job. And it's really important that he's thinking and organizations are thinking strategically about which are the priority organizations to partner with. And then finally, balancing organizational needs with system requirements. And I often like to ask the question, what are you willing to give up for the system or partnership? And that's really where the rubber hits the road. And one example I came across earlier was a PCN primary care network adopting a new piece of tech and thinking about integration and interoperability with other parts of the system rather than just maximizing value for their context and population. If you pop to the next slide, and what we're going to do is turn to developing a system strategy. So again, four components that we think are helpful. Number one, defining the system and its components. When we've done this with a few integrated care boards, integrated care systems, the reactions are always, wow, I didn't realize how much is going on across the board. And just making sure that people understand and have a view of that system is really, really important. Number two, establishing shared visions and goals. Key thing here is that people own what they develop, and making sure that you develop that shared vision and those goals with some of those partner organizations. Fostering collaboration and trust amongst partners, all about investing in relationships and investing the time that it takes to build those relationships and build that trust. And then finally, integrating diverse perspectives and priorities. So making sure that you run an inclusive process that really enables you to kind of tap into the diversity that's part of your population. So next slide, we're supporting a number of organizations with their strategy in different ways. Three recent examples. Number one, over in Essex, we've supported a place-based partnership to develop shared purpose and a culture of trust and generosity. In Southeast London, we recently ran a program building capability for system leaders, so helping leaders of organizations develop the skills and mindset to partner as part of a bigger system. And then finally, working with a foundation called Impact on Urban Health to help individual grantees understand that they're part of a bigger system or program. So I'll end by just, if there's one thing you take away from this, that strategy and partnership isn't just about working together, it's thinking about how you create that value together. And whether you're working on strategy for your organization within a larger system or working on a system-wide strategy, many of the principles remain the same. Understand your role, establish shared vision, align goals, balance need, integrate diverse perspectives, prioritize relationships. I will now hand over to Anne, who will introduce herself and share some of the ways she's been approaching strategy and partnership in her role.